Hello everyone, and welcome to this pilot of the masterclass on Chinese medicine herbs and formulas that will be conducted from October to May. You will find more information about the masterclass in the description of the video. And also feel free to contact me if you are interested or you want to know more about this masterclass. So today we're going to talk about herbs and specifically the blood-moving herbs. So we're going to go through some general principles about blood-moving herbs, the characteristics, functions, and indications. We'll talk about the pharmacological aspect of these herbs. Also, we'll give you a list of the herbs that are within this category and outside this category but have blood-moving properties. We'll talk about how to combine and integrate blood-moving herbs with other categories of herbs. We'll talk about adverse reactions and also importantly how to manage them or prevent them. We'll also integrate blood-moving herbs with other aspects of healthcare that have blood-moving properties, so food, Western herbs, essential oils. We'll finish the lecture by giving more details about 5 individual herbs, including Tauren, Honghua, Chuanxiong, Yuanhusuo, and Danshen. So first of all, of course, blood is an extremely important aspect of nurturing the organs, but also the tissues. So sometimes we talk about the yin wei, and this is really about the qi and blood in the exterior. When it comes to the organs, we just talk about qi and blood directly. But importantly, we need to have enough qi and blood to nurture the organs. So that would be the tonic aspect of things we've covered at the beginning of this masterclass. And also importantly, they have to flow well to be able to reach the organs and tissues. The problem when the blood is not flowing very well, so what happens? And the ancient Chinese have told us pain is caused by blockages, 不通的痛. They also have another saying, which is when you move the blood, you reduce your can eliminate the pain, right? 通的不痛. So this is one thing we always need to keep in mind. When you're facing a patient, they have pain, the first thing you have to think in mind would be, is there any blockage, is there qi and blood that are not moving well? And then you can think about what causes these blockages. And is this more a qi blockage or a blood blockage? All right. So try to think about how you would differentiate between a qi blockage and a blood blockage. So generally speaking, blood stasis type of pain are more specifically it's one specific spot tends to be more like a sharp pain or sometimes like a knife type of sensation, and it might be also more persistent in general. In addition to that, you may have other signs of blood stasis, which are, and you give me the answer, yes, so it would be a purple tongue, purple lips, congested vessel under the tongue. You can also check the nails. I think it's always a good ID. If they are very dark, it's also a sign of blood stasis. You can have more local sign of blood stasis if you check the vessels on a particular channel. Yes, so we'll talk about other things later. Blood circulation is also extremely important for menstruation, and it's not about only period pain, it's really about regulation of menstruation in general, and we use blood-moving herbs a lot for menstruation issues. Extremely relevant for trauma as well, so we know that when we have a trauma, there will be some local bleeding leading to stagnation of blood in the area, and this is not necessarily easily reabsorbed. So that's why we have lots of set of techniques that can help with trauma, and they involved a lot of blood-moving herbs. Also importantly, blood stasis is extremely relevant to mental health, and you can think about formulas such as 水附竹汤, which are widely used for depression, anxiety, and insomnia. Importantly to know also that blood-moving herbs, although they've been there for a while, and you can find them in the Shanghai Lun, for example, but definitely there's been more focus on them over the last, let's say, 200-300 years in China. And I would say even more since we have modern pharmacology, and because blood-moving herbs tend to be relatively well understood by biomedical practitioners, because we can find pharmacological properties that explain their function, which is not the case, for example, for warming herbs or for chitoning herbs. And therefore, I think the biomedical practitioner can make sense of what they are and what they do. So I think that's why one of the reasons why they have been popular in the recent years. All right, let's talk about blood stasis. Where does it come from? There are some direct cause of blood stasis, which trauma. We talked about it. And smoking, I think, is also a cause of blood stasis, and also aging, right? It's just a natural process. Our blood vessels become more and more stiff as we age, and our blood becomes more and more thick, leading to, of course, this blood stasis. Then I think in most cases, blood stasis will be caused by actually other mechanisms, so it's on top of things. So it's generally more, it tends to be a bit more on the branch side of things rather than the root side of things, but it can be quite important to deal with if you want to treat the root as well. So I guess one of the most common one would be qi stagnation and qi constraints that can lead to blood stasis, but also we know that coldness can constrict the blood vessels and therefore lead to blood stasis as well. And it's generally like they will be treated together, especially for pain conditions, for example, or for menstrual conditions as well. So it's coldness and blood stasis at the same time. Also, qi, one of the functions of qi to move blood. So in some cases, qi and yang deficiency can also lead to blood stasis. And then also some more, I think it's more rare, but there are some cases in which yin blood deficiency, because basically the liquid aspect of the blood becomes it's less liquid, so it becomes thicker, and this causing blood stasis. For kind of the same reason, heat can also cause blood stasis, but blood stasis itself is like any type of stagnation, can also aggravate heat as well. All right, so what kind of herbs are blood-moving herbs? They tend to move, obviously, because they need to move blood. So they tend to be pungent, right? And bitter as well, because bitter can drain. But generally speaking, these types of features which we see in qi-moving herbs are not that significant, and they may be a little bit pungent, but generally it's not a very obvious feature, and definitely less than qi-moving herbs. And we're going to see today that the herbs that are more pungent and bitter within the blood-moving herbs is generally herbs that are both qi-moving and blood-moving, all right, that have both aspects. Some of them can be warm. Again, warm is a good thing to move things, right? It's yang, it's activity, so it's moving things. So it's not surprising, and especially for herbs that are both qi-moving and blood-moving, all right? But many of them are also cold, and this is more because blood is by nature yin, right? So we need herbs that are not too young to be able to penetrate the blood and work on the blood, all right? I don't know if that makes sense. So many of them are actually neutral or even cold. So they tend to promote movement, but compared to chi moving herbs, they're not as dispersing as lifting, because again, we need to go a bit deeper. Chi level is a bit more superficial, blood level is a bit more deep. And they tend to be also less drying, of course, because everything what we just said, they're less bitter, they're less pungent, and they're less dispersing and lifting, all right? So there are also less risk of, for example, rise of fire when we take them. Most of blood-moving herbs are roots, and some of them, and especially the ones that are both chi-moving and blood-moving, can be spices. So these ones tend to be a bit more pungent and fragrant. But most of them are roots. Some of them also, and especially the herbs that are have very strong blood moving, what we call blood breaking properties, they can be animal products. So what can they do? The functions of blood moving herbs are so moving chi and blood, regulate menstruation, treat trauma, break stasis, stop blood. The last one is a bit special, but the first four are the most common properties. And you will see it in some manuals, and I know some programs of Chinese medicine, they separate the blood-moving herbs in different categories. I think the reason why they do that is because they want less herbs in each category, so it's maybe makes it more easier to remember for students. But I think it's also very confusing, because when you look carefully, most of the herbs can actually achieve all these properties. They can move chi and blood, they can regulate menstruation, they can treat trauma and break stasis, and can work on all the related indications. So in this masterclass, we don't separate these different categories, but we also tell you which help to have a bit more focus on what property and what function, right? So herbs that can move chi and blood can basically treat pain in the organs, so chest pain, stomach pain, abdominal pain, etc., and in the exterior. So we're mostly talking about B syndrome. They can regulate menstruation. Again, it's not only about period pain, but it can be also delayed period. It can be too many blood clots. It can be endometriosis. It can be lots of things. They are also useful for trauma. Now we kind of rarely use herbs orally for trauma, but it's something we can do as well. I've done it before, and generally we accompany that with external application of herbs. They can be, but also I want to say that for example, there's more and more growing evidence showing that like recurrent micro trauma in the brain can lead to cognitive function impairment, so Alzheimer's disease, etc., dementia, and can lead also to mental health disorders such as depression. And that's when I think we kind of have an advantage here, because in Chinese medicine, we may actually be able to work on the result of this trauma and be able to deal with this dementia or these mental health problems related with microtrauma in the brain. All right, so let's move on. Also, so generally more stronger herbs, we'll call them break stasis or break blood, all right? And this means they can generally break some masses and nodules and hyperplasia. So that's the main four things they do generally, all right? So four things you need to remember: treating pain, regulating the period, treating trauma, and treating masses. All right, so some of them, they can also move blood and stop blood at the same time. So this would be very useful if there is bleeding caused by blood stasis, but also in people who don't have necessarily bleeding caused by blood stasis, but who have a bit of both, who do have bleeding and at the same time they also have some blood problem with blood stasis. Of course, the problem with these two are sort of opposite. Generally, blood-moving herbs, they tend to be anti-clotting, so they will lead to more bleeding, and blood-stopping herbs are actually clotting herbs, right? So they promote clotting. So they kind of have an opposite directions. At the same time, it's very common in the clinic to have problem with both at the same time, and in this case, herbs that can both move blood and stop blood would become very useful. All right, it's very also common to use blood-moving herbs for mental health conditions. So think about depression, anxiety, schizophrenia, etc. Neurological conditions such as stroke, just simply, or peripheral neuropathy. So think about anything that damages the nerves, leading to numbness, pain in the body. There is space here to use blood-moving herbs. Cardiac and vascular conditions, so that this one is a bit quite straightforward. Acute inflammations as well, so this one is not necessarily straightforward. So for sores and boils, our main, I would say, direct effect would be with heat toxicity clearing herbs, but blood-moving herbs do definitely have something to do here. Also importantly, like blood-moving herbs are really good for older adults, because we mentioned that aging is leading to blood stasis quite naturally. So it's not uncommon for when we're treating older adults to add a few blood-moving herbs, not because we've diagnosed blood stasis, but we know that something underlying here, and that's we would just want to help their health in general. So we want to prevent this effect of aging on the blood vessels and on the thickness of the blood. Also importantly, it's very possible and very common to use blood-moving herbs in a clinic for conditions that are persistent and treatment resistant, even though, again, we don't have really any clear sign of blood stasis, such as a purple tongue or, congested blood vessels under the tongue. And even though it's not cardiac disease or it's not period pain, but just because the treatment, the patient doesn't respond to treatment, and we think our diagnosis is correct, this is an option that you have as well. Okay. Also, we can use some blood stasis, blood-moving herbs to prevent blood stasis from blood-nurturing herbs, and also blood-stopping herbs as well, right? The pharmacological activities, again, they kind of match what we're expecting. So they're working on the hemorrheology, which is basically how consistent, the consistency of the blood. So they tend to make the blood less thick and less sticky, so it moves better, right, if it's less thick and sticky. They also, of course, have anti-clotting properties, including being against the coagulation, aggregation of platelets, but they work on lots of different aspects of the clotting, which is different from biomedical drugs, which tend to have a very specific effect on some aspect of clotting. They also improve the circulation in the capillaries, and they also improve the hemodynamics. So this is another aspect of blood. It's about the blood vessels themselves, right? So it can, for example, enlarge the blood vessels, which will make the blood flow better, all right? In addition to that, many of these herbs do have can reduce lipidemia, and we know that this is one of the reasons why the blood is thick and sticky in the first place. So reducing lipids in the blood makes complete sense when we think about moving blood, right? And it's also something to consider when we're treating people with obesity and hyperlipidemia, hypercholesterolemia. We can think about, working on the spleen and stomach, helping them to transform phlegm, dampness, and these sort of things. But we can also think about blood-moving herbs, and it may be really good to add a few of them. Interestingly, also they can strengthen uterine contraction. So when we think about the effect it has on menstruation, it may be because of the hemodynamics and hemorrheology aspect of the herbs, but the fact that it's pushing the uterus to let the blood out of it is also maybe one of the reasons why these herbs are so important for menstrual conditions. Also, we have lots of evidence showing the inhibition of abnormal tissue growth, which include anti-tumor and anti-fibrosis properties, but which is a very widespread effect on abnormal tissue growth. Additionally, so this is things that kind of we would expect, and that makes a lot of sense. But it's also important to understand that they have analgesic effects. So when we think about pain is due to blockage, and we're using blood-moving herbs to move the blood, this effect of blood-moving herbs on herbs might not be completely due to the effect on blood vessels and the thickness of the blood. All right. They actually may have direct effects on pain through different pathway from the blood that may be not related at all with the blood itself, and achieve these effects. All right. So I think it's important to understand that when in Chinese medicine we interpret things a certain way, we say, oh, there's pain, so this is blood stasis, let's move blood. Yes, so that makes sense from Chinese medicine perspective. It's not necessarily 100% of the time always related with a problem with the blood vessels and the thickness of the blood, right? It may be just the way we perceive things, and we've understood things from experience from hundreds of years. But from a clinical perspective, it doesn't really matter, because we know that our herbs are good for these conditions, and that's really the only thing we need to know. Interestingly as well, we've found that some herbs, blood-moving herbs, do have sedative effects, which may actually explain the effect on mental health. And again, this may not necessarily be through what they do to the blood vessels and the platelets and etc., but it might be just more direct effects through different pathway on the brain. All right, so let's talk about the herbs in this category, and you can see that I try always to give you the pinyin name, which is the one we're using most of the time, but also I'm trying to be aware that people who don't speak Chinese may have difficulties with these pinyin names, and therefore I always give you another name. And I would recommend, if you have trouble with the pinyin, to focus more on the alternative name and try to remember that at least. And once you have this entry point with this name that you can remember and recollect, the more you go reading cases, talking with clinicians, seeing cases in the clinic, etc., the more familiar you will get with the pinyin. And because you have these entry points of the alternative name, this will be very easy to connect things. All right. So this is an option I give you. These names are not necessarily the best or the correct ones, but if you have better ones, just feel free to use them as well. Tauren is actually the peach seeds. Honghua is safflower, so the flower. Transition, I will call it the herbal brain because of the way it looks like. Yuan is also called Yanhusuo, but it's actually exactly the same thing. I call it the rabbit poop because it does look a little bit like a rabbit poop, but it's not rabbit poop. It's a root. It's a root of a plant. Yujian, I call it the silver roots. It looks really good. I really like the way Yujin looks like. Jianghuang is actually turmeric, so the roots of turmeric. Ruxiong is the frankincense, and Moyao is the myrrh. Danshan is a root. It doesn't really have an English name, so I just call it the red root. And it looks pretty cool as well. It's pretty cool to have a red root. Yimu Cao is also called motherwort root. This is quite easy to remember. Nusi, when you literally translate it, it's the Kauni root. It doesn't. I don't think it really looks like a Kauni, but it's the way we describe it. We have Disuetang, which is a chicken blood wine. Actually, the same direct translation of the Chinese. Sanlong, same translation, 3H root. It does look like a bit of a triangle, so that may be why it's called this way. Ezhu, which is a curcuma rhizome, and a bit similar in the family, similar with Jianghuang. We have Shuizhi, which is a leech, Tubiechong, which is a ground beetle, Sumu, the redwood, and Gucuibu, broken bone root. So the first herbs from Tauren up to, I would say, Jianghuang, and including Danshan as well, including also Ruxian and Moya to some level. So these herbs, the first ones, have a generally more widespread effects, widespread blood-moving effects, right? They tend to be used for pain, menstrual conditions, trauma, and masses. The last ones, so from Yimu Cao and all the way down, these ones tend to be more specific. Okay, so for example, Yimu Cao is generally used for menstrual conditions. Nusi is more used for B syndrome. Disuetang, same, it's more for external conditions rather than internal. Sanlong and Ezhu are more for masses. Shuizhi as well. Tubiechong as well. And then Sumu and Gucuibu are really for trauma conditions. So yeah, you can start to have a sense that some blood-moving herbs will have very widespread blood-moving effects, and some are more limited. And of course, we'll focus on the first ones because that's the ones that are the most commonly used in the clinic. Now, it's important to understand that all the herbs, even though they're not in this category, have blood-moving properties. And the most straightforward example is actually dangui, which may be the most commonly used blood-moving herb. But because it's also a blood-nurturing herb, we'll put that in that category. But technically, it's probably the most commonly used blood-moving herb. All right. And there's also Chishao, Danpi, and Zucao, which are blood-cooling herbs. They do both cooling and moving. Dahuang is actually a really good blood-moving herb as well, relatively strong. Because of this purging effect, lots of people don't use it for moving blood, but actually, if you prepare it correctly, and if you use it correctly, so not at the same time with the herbs, you don't put it at the end like what you do when you want to have the laxative effect. That one is actually quite good and quite safe. Chuan Mutong, it's an anti-stranguria herb. We don't use it that much because of its potential toxicity. Huzhong is an anti-icteria herb for jaundice. Shanda is a food transforming herb, and this is an example of herb that his blood-moving properties has been found relatively recently due to pharmacological experiments, but it is widely used in the clinic, and the clinicians do think that it helps, so it is also an option and quite safe option as well. Sanqi is a really good blood-moving herb. Actually, we use it especially for pain. It can be really good, but because it also has blood-stopping properties, we put that in another category. Same for Tiansa, Bohuang, and Wolingzhi. They actually can be used for pain and using their blood-moving properties, but in terms of category, they put in the blood-stopping category. Finally, there's Hohuanpi, which is a Shen calming herb, has some very mild blood-moving properties. Not very used that much in the clinic, though. Let's talk about the combination of blood-moving herbs with other type of herbs, because this will give you the ground basis for formulas. So the general thing with blood is we want to have a lot of yang and warmth, because this is yang and warmth is activity, and it will be able to push things, right? So using warm and enhancing herbs such as guizhi, ganjiang, and wuzhu is very common when we're treating blood stasis. It's also quite common to use herbs that are tonic, such as huangqi and renshen. It's a bit less common to use yin blood nurturing herbs, but this can be useful if the blood stasis is due to a yin deficiency in the first place, right? All right. In terms of internal blood stasis, there's generally a mix of different things going on. So qi stagnation, blood stagnation, and phlegm or even dampness. All right, and these tend to be at the same time, regardless of it's a cardiovascular, so a cardiac condition or a digestive condition, even gynecological condition. All right. So in this case, we tend to combine herbs that move qi, such as chai huo, xiangfu, and jingpi, with blood-moving herbs such as dangui, Tauren, honghua, and chuanxiong, and also we may use also some flame-transforming herbs as well, right? Such as banxia, gualao, and jiegong. In some cases, we may add on top of this warming herbs if there is coldness involved as well. Or in some cases, stagnation can cause heat and can make the stagnation even worse. So in some cases, we'll use heat-clearing herbs for internal blood stasis. For external blood stasis, our main point will be really on the wind damp removing herbs, such as Sangzhi, Weilingxian, Haitongpi. And these herbs will be helped by surface liberating herbs such as Shanhuo, Duhuo, Fangfeng, with exterior warming herbs such as Rogui and Ganjiang. And to some extent, we'll use blood-moving herbs to help them, right? So Niuxi, Jixuetang, Chuanxiong. But it's quite rare to use to have the blood-moving herbs being the main herbs or the main action for external blood stasis, right? This is quite uncommon in the clinic. So when we're talking about external afflictions or infections causing fever, and when we get to the level of blood heat, then there is generally some blood stasis involved as well. So we'll combine blood moving and blood cooling herbs in the formula. Then we have bleeding caused by blood stasis, in which case we have to combine blood moving and blood stopping herbs. And of course, the herbs that can do both at the same time will be our the main force, right? When there is massive hyperplasia, we generally combine blood moving herbs, and that's the strong ones, right? The one that break the blood. Remember, we talked a lot of them are animal products. Salong, Zhu, Shuizhi. And we can combine that with herbs that transform nodules and transform phlegm. Right? When there are sores and boil, again, here, blood-moving herbs will not be our main characters. These will be more heat toxicity eliminating herbs such as Jinyanhua, Lianqiao, Pugongyin, etc. And we'll add on top of that blood-moving herbs, and generally ones that are a bit cooler, such as Zhisha, Danpi, etc. Also Ruxiang, Moyao, which can be good as well. All right, so let's talk a little bit about the adverse reactions of blood-moving herbs in general before we go to the details of the herbs. So, of course, bleeding is the most common concerns, and you have to be extremely careful if the patient have a vulnerability to bleeding because of their conditions or because of the drugs they are taking. You also have to be a bit careful about the menstruation if you're treating females, of course, the blood-moving herbs can create more menstruation, which is not necessarily a problem if that's what you want to do. But if you're worried about having excessive periods, then you need to be very careful, right? Menstruation itself is a really good way to get rid of blood stasis, so it's a good opportunity to use blood-moving herbs, but it can lead to side effects if you're not careful. Also, pregnant women, I would just, at this level of your learning, I would say contraindicated. If there's really threat to the fetus and mother due to blood stasis, there might be actually opportunities to use them, but I don't think most people who are watching this video will be involved in these situations. Important also that the strongest herbs are contraindicated for people with a weak constitution. They may use up too much of their resources, so you need to have a different strategy. How to prevent and manage that? So take a very good patient history, especially for vulnerability to bleeding due to some of the conditions they have, and to anticoagulant medication. Record this, and etc. Ask about menstruation. So if again, if you're concerned about excessive periods, then just make sure that you're not using the blood-moving herbs before the period, during the period. Ask them if they plan for pregnancy, if they're trying to get pregnant, and if they have anything such as, oh, it's been a while you haven't had your period, then it's better to restrain from using blood-moving herbs and just check for pregnancy. If it's negative, then you can still come back to use them. People who are on anticoagulant medication, they generally followed for their INR, which shows how the clotting ability of the body. So make sure they followed on a regular basis, because it's not like using blood-moving herbs with anticoagulant medication is completely prohibited, but technically you have to work with the doctors to make sure they are safe, right? Because you don't want to have excessive bleeding, which could cause a stroke or something in the brain in some patients. When you're concerned about the risk of bleeding, so what can you do? So first thing, use mild blood-moving herbs such as Tauren instead of herbs such as Tauren and Oju, which are stronger blood-moving. Also, you can add a bit of blood-cooling herbs or blood-stopping herbs, Chishao, Dampi, and Santi, to control this, to prevent the bleeding, really. Start with low doses and then increase if necessary. If bleeding happens, it really depends on the situation. Some situations very acute, then people need to get to the emergency directly. If it's just a bit of hematoma somewhere here and there, some bruises, then you just may want to reduce the doses, start to change your dynamic of the whole formula, or assess depending on what the benefits and what the risk, and assess based on that. A lot of foods can achieve blood-moving properties, including wood ear. So this is a sort of fungi that is used in Chinese cooking. There's hawthorn, which is actually a herb. We already talked about that. It's called shanja. There's vinegar, which is also have blood-moving properties, and actually I'm just thinking about it now, but alcohol also have blood-moving properties. Of course, it may not necessarily be appropriate for everyone, but it can be an option. Some condiments such as ginger, onion, garlic do have blood-moving properties, and from our perspective, it's because they can move qi and therefore move blood. Interestingly, grape, but only the skin of the grape can move blood. Tomato as well, apparently. Makes sense because it's red, and we saw that lots of red things tend to be blood moving. So brown sugar as well, it tends to be a bit more red in terms of the color. Turmeric, again, cinnamon, spices. There's also rosebuds that you can use in infusions. They're especially good for mental health because they both move qi and blood, so quite good for stress actually in general, or mild cases of depression, mild cases of anxiety. Vitamin E, so we're more on the naturopathy side of things, and grapeseed extract also have blood moving properties. In terms of essential oils, I think helichrysum, frankincense, lavender, and this is, I can't see on my screen, but I think this is, cypress. I've already gone to the next slides. Do have some blood moving properties as well. You can consider, especially on external use of essential oils, can be quite useful. All right, so the Tauren, which is the peach seed, so be careful, we're not talking about the kernel, but we're talking about the seed which is inside the kernel. So if you open the kernel, you will find a seed, and that's what we're talking about. They do look like almonds, so be very careful, they're not almonds. And but the two, almond and peach seeds, Tauren, do share lots of properties, so it's not surprising really. They are a bit bitter, sweet neutral, and they have a mild toxicity, but if you're using in regular dosage, there's not really any risk. They tend to be a bit wet, like many type of seeds and nuts have this, because of the fat they have, the lipids they have inside they contain. And also Tauren tends to have to have a descending property, which is related with these laxative and antitussive functions. So it's a relatively strong blood-moving herb, actually, although it's used a lot in the clinic. It's and it's also a widespread effect on blood-moving properties. So we use it a lot in gynecology, but we use it a lot for pain conditions. You can use it for trauma, and you can use it for abscesses, and especially internal organ abscesses. So we're talking about intestinal and lung sort of abscesses. So in addition to that, it does have some laxative effects, which can be a side effect if you're not careful. So if you're concerned about people with spleen deficiency and having some loose stools, Tauren may not be necessarily the best option for you. It does have also some antitussive and anti-dyspnea functions, but not as much as Siren. So it does have some toxicity, which is due to amygdalin, which can decompose into hydrocyanic acid and then inhibit the respiratory center of the brain. I've never heard about anything related with that. I think it's extremely rare in the clinic, and this may really due to overdose. So as long as you keep relatively normal dosages of around 10 grams, it's not something you should be worried about at all. Honghua is it looks very nice. It's red herbs. So we mentioned them. Lots of red herb do have blood moving properties, and some of them have blood nurturing properties as well. It's very light because it's a flower, right? So and it's also pungent, warm, and fragrant. All right. So in terms of so these properties kind of explain its moving aspects. It's not as descending as Tauren, but it may be a little bit more dispersing and moving. It has a very wide range of blood-moving properties, and because it's a bit pungent warm, so it's really good for pain. So it's kind of our chi-moving, blood-moving dual effect, even though it's still not recognized this way. It's also really good for gynecological conditions, and it's still a relatively strong blood-moving herb, so we can also use it for masses and trauma. All right, again, very widespread blood-moving effects, and that's why. And we also combine Tauren and Honghua quite a lot. So think about formulas such as Tao Hong, Su Wu Tang, which is the kind of basis of lots of formula that move blood. So it's a very common one. Our little bonus of Honghua is that it can remove spots. So think about chloasma, which is brown spots on the face. It's really more common in females, especially around menopause. And Honghua can help with that. both internally and externally used. Dosage generally 10 grams. Transient now, I think I like to call it the Herbal Brain, because it does look like a bit like a brain. It's like an MRI of a shot of an MRI that you slice it. So it looks a bit funny compared to other herbs. Then it is, so this one is a typical tea moving, blood moving herb, right? Dual tea blood moving herb. So it's pungent, warm, it has a thick smell, it's dry, it's lifting and dispersing, right? So this is kind of the properties we're expecting from tea moving herbs, right? Or some of the warm surface liberating herbs such as 江火, 毒火. So it's not very surprising that it's both a tea moving, blood moving herb, and therefore we use it a lot for pain, both internal pain and external pain. But we can also use it for liver constraint. It's quite common, transient, for cardiovascular conditions and for gynecological conditions, right? So it has this thing of moving qi and blood internally. But also, because it also have like wind removing or wind liberating properties, is also used externally for B syndrome. It's also used, it's also used orally, but for external pain such as B syndrome. And I think it's important for understand with transient that it's extremely widely used for headaches, and headaches from all kind of causes. All right, so regardless of the reason or the cause of the pattern of the headaches, transient is kind of the buster of the headaches, that the herbs that you may want to add at the end of the formula to help with the headaches. It's also something like, for example, if you're treating a patient for something else completely different, and they mention, oh, by the way, I do have a bit of headaches from time to time, and you want to help them with that, that's the herbs you may add in the formula. It can be used raw or prepared with alcohol, which will strengthen its warm dispersing characteristics. And of course, the problem, because it's dry and lifting, there's a risk of rise of fire. All right, so be careful when people do have some iron deficiency or blood deficiency, because it can lead to rise of fire. So dosage is generally about 10 grams. So Yanhuo was the one that looks a little bit like a little rabbit poop. If you open it, it actually looks very nice inside. It's quite similar to transient. It's also pungent, bitter, warm, dry, and dispersing. So very similar to the qi moving herbs such as Jingpi or Chenpi, etc. Surface liberating herbs such as Guizhi, Fangfeng, etc. Its blood moving functions are relatively mild, I would say. So we tend to use it more for pain and gynecological conditions, but we're not going to use Yanhuo for example, breaking masses or this sort of things. All right. It can be prepared with vinegar, which actually help the extractions of active constituents, and the dosage is generally around 10 grams as well. Danshen is the red root. It tends to be a little bit bitter, and this one is actually slightly cold. All right, so it's different from the qi moving, blood moving herbs we just mentioned. It has, I would say, moderate blood moving properties. It's not too strong, but it's not too mild either. And it also have very widespread blood moving properties. Sometimes there is a saying which is danshen, one single ingredient danshen can replace sebutang, which is our a very famous blood moving formula. So it has a widespread range of effect, and it's especially good for gynecological conditions, but also cardio and cerebrovascular diseases, and because we found it has many properties, pharmacological properties, that help the blood vessels of the brain and the heart. It can also be used for pain, trauma, and masses. But what really take advantage of his cooling nature is when we use it for sores and boils, and also for warm diseases. Another thing is it does have Shen calming properties, so it's not uncommon to use danshen for agitation and for insomnia, which can be related with its blood moving property, in which case it's even better, like if it's a broad stasis type of mental condition. But even if it's not a blood stasis form of mental disorder, we can also use danshen. And an example would be Tianwan Buxindan, in which danshen is used only for its Shen calming properties, really, not for the blood moving properties. We can use danshen raw, in which case it's more cooling, and we can also prepare it with alcohol, which make it more warmer, but also have a stronger blood moving properties. Generally, danshen we tend to use a bit higher dosages, such as 15 grams, but we can go up to 30 grams. It will be still relatively safe.